After the initial planning by the engineer, the primary plan parameters for this patient are as follows. The size of femoral component we selected is the 3.5 of the A3 prosthesis from AK Medical. The size of tibial plateau is the C+ of the A3 GT prosthesis. Femoral valgus angle is 5.8 degree and external rotation angle is 3 degree. These are the thickness of osteotomies the femur in various sites. The posterior slope angle of the tibia is 5. This is the thickness of osteotomy of the medial and lateral sides of the tibia. After the design in version A, we found that 1. The thickness of bone resection at the posterior condyles of the femur is less than that at the distal femur. The size of femoral component is appropriate in medial-lateral direction. 2. There is bone collapse in the medial tibial plateau, which could be eliminated after osteotomy. 3. There is excessive posterior slope angle of tibial plateau. Subsequently, we can utilize the patient's imaging data and the three-dimensional images provided by the engineers to meticulously observe the planned outcomes in the pathologically from various directions. Considering the patient's deformities and pathological changes, as well as surgeon's preferences, we optimized the design parameters of version A. After making these adjustments, we generated the planning results for version B. The modified parameters compared to version A are highlighted in red. The femoral prosthesis is positioned with an overextension of 1.5 degree, allowing for a greater amount of resection of the posterior condyle of the femur compared to the distal femur, to achieve a relative balance between the flexion and extension gaps. The tibial component is possible to achieve a relatively good coverage of the tibial plateau. These are all osteophytes of the tibial. We can observe the collapse of the tibial plateau. Besides these 3D planning, we also carry out a standard preoperative planning based on routine X-ray images whether PSI is used or not. These images include the full-length anteroposterior X-rays, a full-length lateral X-rays, local anteroposterior and lateral X-rays, as well as axial X-rays of the patellofemoral joint. All planned parameters will be documented in a dedicated planning table. This encompasses the patient's demographic information, preoperative WOMAC and KSS scores, and the ROM of the knee joint. We also need to pay close attention to the situation of diabetes, as we aim to minimize the probability of paraprosthetic infection. The figure depicts preoperative planning parameters, encompassing the full-length HKA angle, type of deformity, as well as certain parameters on the femoral and tibial sides, and those of the patella. This section is intended for measuring